If you've been told you need a ureteroscopy, you might be feeling a mix of nerves and, well, uncertainty. And honestly, it's completely normal to have questions about what this procedure actually involves. Today, we're going to break it down simply, step by step, so you can feel informed, prepared, and confident about the path forward to feeling better. Okay, so let's dive right in. The biggest question on your mind right now is probably, what exactly does a ureteroscopy involve? Look, I know it sounds like a big, intimidating medical word, but I promise you, by the end of this explainer, you're going to understand exactly what's happening and why it's such an effective, routine procedure for dealing with kidney and ureteral stones. Here's our quick agenda for today. First, we'll look at what a ureteroscopy actually is. Then we'll cover preparing for your procedure, what happens inside the operating room, how it compares to other treatment options, and finally, your recovery and next steps. All right, Section 1. What is a ureteroscopy? So, a ureteroscopy is a minimally invasive procedure used to treat kidney stones or blockages in the ureter. That's the tube that carries urine from your kidney down to your bladder. Your urologist uses a really thin, flexible scope with a camera to see inside these narrow passages, all without any external incisions. Think of it kind of like a plumber using a tiny, flexible camera and a specialized tool to clear a pebble from a garden hose. They ensure the water can flow freely again without ever needing to actually cut the hose open. It's a highly effective way to clear those blockages while keeping your recovery time as short as possible. This is what we call a natural-orifice approach. That means the thin camera goes straight through the urethra, into the bladder, and directly up the ureter. There are literally zero external cuts made on your body. The doctor simply utilizes your body's natural pathways to get exactly where they need to go. Moving on to Section 2, preparing for your procedure. The crucial point before surgery is getting your body ready. Your pre-procedure checklist involves fasting, which means absolutely no solid foods after midnight. You'll also need to provide a urine sample for UTI testing, because according to clinical guidelines, doctors absolutely cannot proceed with surgery if you have an untreated bacterial infection. You'll review your medications with your team, especially any blood thinners. And finally, you definitely have to arrange a ride home, because this procedure requires anesthesia and is an outpatient procedure, meaning you go home the exact same day. You cannot drive yourself home. For sure, line up a friend or family member for that one. Next up, Section 3, inside the operating room. We can break the surgery down into 4 straightforward steps. First, the anesthesiologist administers general anesthesia, so you won't feel a thing. Second, the urologist inserts the flexible ureteroscope. Third, they break up or remove the stone. And fourth, they place a temporary ureteral stent. Reassuringly, this entire process usually takes less than an hour or two. Now, this is the really fascinating part. Once the doctor locates the stone, they extend a flexible laser fiber right up to it. The laser is used to effectively dust the stone into tiny pieces, or they might use a microscopic wire basket to capture those fragments and pull them right out. It's incredibly precise technology. At the end of the procedure, you'll likely have a temporary ureteral stent placed. This is just a soft plastic tube that sits inside the ureter to keep the pathway open. It prevents any swelling or remaining debris from causing a blockage, allowing your kidney to drain urine properly as your body naturally recovers over the next few days or weeks. Let's look at Section 4, comparing treatment options. Often, patients hear about a different procedure called ESW, or extracorporeal shockwave lithotripsy, which uses external sound waves to break up stones. The main difference here is that ESW is an external approach, whereas ureteroscopy, or URS, is a direct, internal approach. Ureteroscopy is often considered the gold standard. According to the American Urological Association guidelines, URS gives you a higher immediate stone-free rate. Because the doctor physically extracts the fragments, you don't have to wait around to pass large, painful chunks at home. It's exceptionally effective on very dense stones that those external shockwaves just can't crack. It's ideal for stones trapped in the lower or middle ureter, and it's a completely safe option for pregnant women or patients on blood thinners. And finally, Section 5, recovery and next steps. These postoperative side effects are completely normal, so you really shouldn't be alarmed if you experience them. You might see some blood in your urine, feel a constant urgent need to urinate, have some discomfort from the stent, or experience mild to moderate lower back or side pain. The absolute crucial point here is that you need to drink double your normal amount of fluids for the first 24 to 48 hours. This helps flush your system, clears out any blood clots, and greatly reduces the risk of infection.
The good news is recovery is typically very rapid. Most patients are discharged the exact same day. Any lingering burning sensations or bladder spasms can be easily managed with simple over-the-counter pain medications like acetaminophen, your prescribed medications, warm compresses, and of course, plenty of rest.
Remember, you don't have to navigate this journey alone. Your urologist is your best partner in this process. If you have any specific concerns about your condition or the recovery process, please reach out to your healthcare team. They are there to support you. Thank you for watching this explainer, and here's to your health and comfort. If you found this information helpful, please like and subscribe for more evidence-based content on urology.
I'll leave you with this final thought. When you look at the entire journey from a higher immediate clearance rate to requiring absolutely no external incisions, isn't it amazing how modern medicine can seamlessly eliminate such a painful problem? I hope you feel empowered, informed, and confident about your upcoming procedure. See you next time.